Cases of Ebola virus have been confirmed in the Eastern Democratic Republic of the Congo, this according to the country's health authorities as they prepare to deploy an experimental treatment.
The new cases emerged just as the World Health Organization has placed a death toll so far from this latest outbreak at 34. This is the country's 10th Ebola outbreak since the virus was first identified near northern Congo's Ebola River in 1976.
Government said in a statement late on Friday that the latest confirmed cases near the town of Mangina in Congo's North Kivu province bring the total for the current outbreak to 21. Authorities this week began vaccinating health workers and people who had contact with confirmed cases. The experimental vaccine proved effective against an outbreak in Western DRC that ended late last month. So far, 43 people are believed to have been infected in North Kivu and Ituri provinces. World Health Organization officials visited a hospital in Beni in the country on Friday to monitor the ongoing response to an outbreak of the deadly Ebola virus and discuss areas that need particular support.
As you know, this region, especially eastern region, is different from the west. As you know, there is instability, high population density, high movement, and that may require actually stronger response. So there is leadership from the government, but all communities here should also be involved and take ownership in fighting Ebola.
Ebola, which causes fever, vomiting and diarrhea, is spread through direct contact with body fluids. It killed more than 11,000 people during the largest ever outbreak in West Africa from 2013 to 2016. Authorities in the country, which has experienced 10 outbreaks since 1976, have been more successful in containing it. But the current flare-up poses fresh challenges as it is in a part of Congo stalked by myriad militia groups that regularly battle one another and kill and kidnap civilians. So far, however, the disease has not touched so-called red zones, where security risks would severely limit access for health workers.
We have invited Krista Armstrong, the International Committee of the Red Cross Communications Manager for Africa, and she joins us now via Skype from Geneva in Switzerland for more on this story. Very good evening to you, Krista. Thank you so much for joining us. Now, a team of Red Cross experts has arrived in the town of Beni, now close to the epicenter of the Ebola outbreak in North Kivu in the Eastern Democratic Republic of the Congo. What's their plan of action?
So we have a combined team of the International Federation of the Red Cross and Red Crescent Societies, the Congolese Red Cross, and the ICRC who are responding in this area. And the team is going to specialize in 4 main areas. And first amongst them is the safe and dignified burials of those who have died or suspected have died of Ebola, because when someone has contracted and passes away from Ebola, they're most contagious right after they die. So it's very important that communities are able to bury their loved ones safely and in a dignified manner. So we've been training volunteers in the area to carry out these burials, and they've already started them. Secondly, one of the main areas is to provide information to the population, to communities in these affected areas, to know what symptoms to recognize, to find out more about the disease, and to know where to go to get support and help and advice. And thirdly, we also want to ensure we support water and sanitation systems, and specifically in prisons. Prisons can be vulnerable to such outbreaks because of the proximity of prisoners and the amount of people who are in them. So that's a key area that we are looking at. And finally, it's also to support healthcare centres and hospitals with infection and prevention of diseases. So, for instance, we provided 2 tents to Beni Hospital to help triage and isolate suspected cases.
And I suppose that some of the problems are accessibility, getting some of the vaccines to the affected communities. Take us through some of the main challenges working in conflict areas.
Sure, absolutely. I mean, I think what you have here is an outbreak of a deadly disease which combines with the conflict situation. So already communities there are highly affected by the violence and by the conflict. You've got thousands of people who are regularly displaced. Mangina, the town where this outbreak was declared, is actually a town which was relatively considered safe safer over the last few years. So it's an area where many people have actually fled to. So many people are actually staying with communities there. So they're, in close proximity. So that's an additional challenge. It's an area with a relatively high population density. More so than in the western part, but especially that conflict and that security aspect is going to be a real challenge. The Red Cross movement were not involved in carrying out the vaccinations, but obviously we know the area well. ICRC has had a permanent office in Beni since 2008. And we know that some of the main challenges is getting to certain areas safely to carry out such vaccination campaigns, to be able to carry out safely and with proper access. So that's going to be a real challenge of the response, also to trace cases effectively, so that to prevent further infection.
Yeah, on the point of preventing further action, tell us, how does the Red Cross volunteers who are carrying out the safe, the dignified and safe burials, being trained, and of course the importance of this work to avoid infection?
The Congolese Red Cross volunteers, they're on the front line, and what's happened here is they are from the community, so they've been supported by a team that's come from from Mbandaka, where the previous outbreak happened. So they're the frontline team. And then, meanwhile, in the past few days, we've had 48 volunteers who not only are volunteers with the Red Cross, volunteered for the response because they want to help both men and women. So they've been trained in carrying out, both safe practices to clean people's homes after someone is deceased of Ebola, suspected of Ebola, as well as how to carry out that burial safely. So with the right cleaning, the body cleaning, the right areas, and providing, also hygiene promotion to the community so they know what to do and how to alert the Red Cross volunteers in first instance.
Now, Krista, I want to engage you about the geography of the outbreak. The port city of Mbandaka is very close to the Congo River, and you know that it serves as a porous border between the DRC and the Republic of the Congo to the west, and of course to the north is the Central African Republic. Does this at all concern you?
At present, there's been no indication, and the World Health Organization and the Ministry of Health have not indicated any indication that the cases are linked. However, if we look at this particular area, so Beni city is a city of 230,000 or so people, which is about 30 kilometers away from where this outbreak happened. So quite a populated area, but also not far from an international border with Uganda, not far from another province to the north where, there's risk. It's also because of the violence, because there's a constant fluctuation of people fleeing violence and seeking sanctuary in new places or returning home, as well as trade. There's a lot of trade in these areas. There's a high mobility of population. So that's the main challenge in terms of containing this outbreak and ensuring that it doesn't spread further. So that is an absolute key challenge. And I'd add, just because of the very difficult conflict dynamics, it's also difficult, the vaccinations we talked about before, but just a logistical challenge also of bringing, these vaccinations. You have to ensure a cold chain supply to ensure that they can be carried out in these areas logistically is a challenge as well.
Is the Red Cross adopting the traditional tried and tested approaches such as isolation of the affected ones?
So it's very important to clarify that we're not involved in the treatment of these cases. That's carried out by other organizations. But in terms of ensuring safe burials, absolutely there are guidelines, and that's part of what the Red Cross is doing, is also informing communities of what to do initially in the first phases to ensure that there's no further contagion to others, and especially at that point when people are being buried or burying their loved ones, that they don't put themselves at risk, that the Red Cross volunteers can come promptly to support, and they have the right equipment, they have the right gear to really be protected, and also then disinfect the areas which might have been infected by the body, for instance. So that is a crucial part of this work. Again, at the moment I was speaking to colleagues in the area, they were saying things, life seems quite normal at the moment. The atmosphere is not one of panic or people are fearful. but it's not. It remains. People are still moving around. They're still carrying out their work in the field. Repairing motorbikes on the side of the road. Life still has got a certain normality, but awareness campaigns are crucial so people know what to do and how to respond when they see symptoms or feel symptoms themselves.
Talk us through the experimental Ebola vaccine. How is that working out?
So again, it's the Ministry of Health, the Congolese Ministry of Health and the World Health Organization are carrying out these vaccinations. So they started a few days ago. I can't comment on how they are going at this point. All I know is that they were initially for all the healthcare workers and for any suspected contacts with Ebola cases. All
right, Krista, thank you so much for your update. We appreciate your time. That is Krista Armstrong speaking for the International Committee of the Red Cross. She is the Communications Manager for Africa and she joins us via Skype from Geneva in Switzerland. This is The Globe on SABC News. Thank you for joining us. Let's take a short break. We'll be back with more news shortly after.